Dorothy, our subject this afternoon on the comment line, emotional shells in traumatic experiences. Did you have a comment?
Well, I'm just answering to the young lady that called a while ago, you know, and said she had 2 children, and she was so depressed about her husband.
Yeah.
Well, the thing she needs is friends. That's the only cure. I went through the same thing. And the only thing that cured me was having true friends. And she shouldn't think that all men are like the first one. Supposing men thought that all the women, if they were in that same condition, were the same. And she has to make up her mind to have friends and trust others.
So friends worked for you?
Yes. You have to have true friends and go out and forget. And she must remember she has 2 children to live for.
Right.
That is all I had to say.
Beautiful. Thank you for calling.
And I thank you.
Bye-bye.
Bye-bye.
Emotional shells, traumatic experiences. Peggy, did you have a comment?
Yes, I do. I would like to say I have been listening to your broadcast, and I agree with many things that have been said.
Right.
Although I would like to express personally, I've been through some of these traumatic experiences. As a matter of fact, I am 25, and I've lived through 25 years of constant trauma and depression. And I would like to tell the people out there that are having these problems of nervousness, crying, self-hatred, loneliness, or anything of this type, and these deep depressions, please to seek psychiatric help. It is available.
Exactly.
And I think that it would really benefit them tremendously. It has me. I've had a year of therapy, and although I'm not out of the woods yet, I'm on my own, and I'm doing very well now. And I can thank my therapist for that.
And there is no stigma with that.
No, of course not.
It's the same as breaking an arm.
That's right. If you're afraid that people will laugh, they won't. When you go in, they're very nice, they're very kind, and they hear what you have to say, and believe me, they certainly do help.
How did you go about finding help?
Well, if I may mention the services that I used the River Region services. It is based on your income. You pay what you can afford. They are very nice. They have competent personnel, and my therapist was an angel, just an angel.
Beautiful.
But I would also like to suggest to some of the readers that would prefer to try something else before they go seeking psychiatric help, or psychological help, I should say. There is a book that I have read that was of great benefit also.
I'm okay, you're okay.
No, not that one. That's a good one also. But the one I'm thinking about is a 54-page book. It takes about an hour to read. The name is How to Be Your Own Best Friend. And this is by Mildred Newman and Bernard Berkowitz. And also for the lady that called in about having just been divorced, perhaps she could try reading Creative Divorce. And I'm sorry I don't know the authors.
Very good. Peggy, thank you for calling.
And thank you for listening, sir.
Bye-bye. Dorothy, this is Dorothy Day. Welcome.
I just would like to comment on the woman that talked a while ago about her River Region and the kind of help she's getting.
Right.
The saddest thing after psychiatric help, when you think everything's going beautifully, and all of a sudden they're not going to see her anymore, and she's going to have to face reality, and that's when the low blow comes.
How's that?
Because there isn't anybody else right at that time, and you're on your own.
There's always something else, Dorothy.
No, not really.
Well,
no.
What we were talking about, a multifaceted approach to this thing. Whatever works, and
if you've gone so long, and you've gotten therapy, and you've gotten everything else, and you really feel great, you think you can fight the whole situation, and you will refer your psychiatrist to everybody else, or as it, in her case, River Region, and she evidently is still getting their help, and then all of a sudden, when she isn't getting it anymore, that's the downfall, and there is no one else to help you then. They make you feel so good while you're being treated, and then you are just dropped completely, and I know you do have to do it on your own. But it's really sad. Then all of a sudden you're so completely on your own, and you can't live your life being dependent on a program. But they build you up too much. You know, I don't know. That's just what I
Right.
Thank you.
Dorothy, thank you for calling.
Thank
Bye. Emotional shells, traumatic experiences. Jackie, you're in counseling, right?
Right.
And we were talking about programs that do exist on a continuing basis.
Oh, most assuredly. It doesn't have to be connected up with a psychologist or even a counseling session. Recovery Incorporated here in Louisville makes it a habit only to use lay counselors. If you want to go to recovery, you have to be a patient that's had a mental problem.
Right.
If doctors and nurses want to go there, or psychologists or whoever, they have to go there either to observe or as a participant. They don't go to treat people. And other groups, well, depending on what your problem is, Alcoholics Anonymous, Overeaters Anonymous, they've even got, I don't know, Rage Anonymous or something like that that started lately for people that can't control their temper.
Right.
And the idea of counseling is not to cure the patient at all or the client. The idea is mainly to get them to the place where they're autonomous enough or on their own enough to make decisions so that they know when they got to go back for help. And
I guess there's what you would call it, a mental image, I think, that in some programs, movies, whatnot, that we see a psychiatrist doing his number on a person, and it's a one-shot deal, and they come out.
Catch and all.
Right, they come out and everything's fine.
But that,
And
it's not an overnight shot. Looking at it from Freud's point of view, the trauma goes way back in the person's age to their early childhood. Many other psychologists and psychiatrists have other views as to when this trauma started.
Right.
But in 2 weeks or 4 weeks or 6 weeks, if you're going to treat the patients on the basis of their past history, you can't cure them.
Right. Well, it's just, again, I think people find themselves in an emotional situation or traumatic, thing, and would like, as anyone in a situation like that, an immediate cure. And we talked about emotional problems being the same things as broken arms, right?
I think a more apt comparison would be diabetes.
Yes, yes.
You don't cure diabetes, and the person with a psychological problem may never be truly cured, but he can learn to cope and learn how to deal with the problem on a day-to-day basis, which is the most important way of handling it on a one-to-one, one time, even on a 1 minute to another minute.
I think group therapy, how do you feel about that? That's something new, relatively new, as far as...
Well, on the outside maybe, but out in the public life, but they've been using group therapy for years in the mental institutions or in a lot of other settings. They've used the group therapy, and it's very popular, and it works very well on the sense of it's not only the group leader who is, of course, trained to handle the group or to lead the group.
Right, trained psychologist or psychiatrist.
Right, or social worker or counselor, person with MA in counseling, something like this, or some type of postgraduate work. But the main beauty of group therapy is very often it's not the psychiatrist or the group leader that calls the bluff of the person who's in group. It's their peers, the other people in the group.
Right. Would not one of the aspects, the good aspects of group therapy outside of like encounter, type situations, would be just a group of people to meet with and to talk to that have similar problems?
Well, that's essentially what recovery is.
Recovery Incorporated. They go there, and everybody knows, it's no holds barred. Everybody knows what the other guy's problem is.
Right.
And when they start talking about their problem, people call them up short. Something you got to deal with. Let's deal with it. Let's not talk around it.
Right.
So with the group setting, in many instances, there's someone that you can turn to if between group meetings you get low. You can call somebody or talk to somebody. There's many different hotlines. In addition, the crisis lines in Louisville.
Another aspect of, say, we were talking earlier about going through divorces, things like that. When that occurs, people by force have to change their life status. They're no longer married. They have other things that are happening. Many times they move. They move away from their friends. Maybe they did not have that many friends to begin with, and we have another situation occurring simultaneously with the basic emotional problem that they may have had, and that's the upset of a normal lifestyle, of their lifestyle. And so, again, the emphasis on friends, beautiful friends to help you. To talk with.
Somebody just to sound off to.
Right. Excellent. Jackie, thank you for calling.
All righty.
Bye-bye.
Bye-bye.
Peggy?
Yes.
Yeah. Go.
I wanted to make a comment about Dorothy. I respect her opinions very much, but I would like to expound on that point just a little bit more. About the therapy, the counseling. There is continuing counseling, and I believe she's losing sight of the individual. I think she's leaning a little more towards the program. Yes, they do build you up, but you also build yourself up. You retain inner strength. If you didn't have the strength to begin with, you wouldn't have asked for help, point one. And you build up your strength, your endurance, very slowly, inch by inch, day by day, and it is very, very heartbreaking, to be truthful. And then when you reach a point where they feel that you don't need therapy anymore, then you may give it up, which I am out of therapy.
Right.
I've been out of therapy for several months. I am currently enrolled in college, which I would not have done without the therapy sessions. I am going to get a pre-med degree.
Wow.
And hopefully attend U of L and become a psychiatrist, preferably a child psychiatrist. And age 25, I think this is pretty good.
That's beautiful. It really is.
But I really felt that I'd left my point a little at loose ends, and I just did want to clarify that.
Right. And the other aspect is, too, that if a person goes to counseling and they're not prepared to get down to brass tacks and to face their thing, then counseling really is not going to do them that much good.
That's right.
They have to be ready for it emotionally.
That's right. If you are not ready for it, it won't do you a bit of good. And you can't go in and expect miracles.
Right.
You have to work at it, and you have to work darn hard at it. So it's really up to you. There's just guidance, and you're on your own.
Right. Peggy, thank you for calling.
And thank you very much, sir.
Thank
You're doing
you.
a fine job.
Beautiful.
Bye-bye.
Bye-bye.